Many people live in a constant state of tension and exhaustion without understanding why. They sleep poorly, they wake up tired, their muscles feel tight, their concentration fades, anxiety becomes normal, and yet, medical tests often come back normal, leaving them with the impression that nothing is wrong. What most people are experiencing is not a mysterious condition. It is a silent insufficiency, one that affects millions of people and quietly disrupts hundreds of biochemical processes in the body. That insufficiency is magnesium. Magnesium is not a supplement trend. It is a foundational mineral. It is required for life itself. Without magnesium, cells cannot produce energy. ATP cannot function. Muscles cannot relax. Nerves cannot calm down. Blood vessels cannot dilate properly. And the brain cannot maintain balance. Despite this, modern life has created the perfect conditions for chronic magnesium insufficiency. For most of human history, magnesium entered the body through two main sources: food and water. Natural water contained minerals. Soil was rich in nutrients. Plants absorbed those minerals and passed them on to humans. That reality no longer exists. Modern water is treated and filtered. Minerals are removed. Soil has been depleted by decades of monoculture farming. Crops are grown repeatedly in the same land, stripping minerals year after year. So when people say that spinach or vegetables contain magnesium, they are often relying on data from decades ago, not on current agricultural reality. Ultra-processed foods dominate modern diets. These foods displace mineral-rich foods and add nothing in return. At the same time, chronic stress increases cortisol, and cortisol increases magnesium loss through the kidneys. Coffee and alcohol further accelerate magnesium excretion. Many commonly used medications, especially acid-suppressing drugs like omeprazole and similar compounds, impair magnesium absorption over time. Antibiotics alter gut health, which also interferes with mineral balance. The result is not always a clinical deficiency. It is something more subtle and more common: chronic insufficiency. This is why standard blood tests fail to detect the problem. Less than 1% of the body's magnesium is found in the blood. The body protects magnesium fiercely, keeping it inside tissues because it is essential for survival. Blood levels remain normal until deficiency is severe. There is no perfect laboratory test for magnesium status in everyday clinical practice. Ionized magnesium testing exists, but it is typically reserved for intensive care settings. Red blood cell magnesium is sometimes used, but it is not universally accepted. So the body communicates magnesium insufficiency through symptoms: muscle cramps, twitching eyelids, fasciculations, bruxism, anxiety, restlessness, difficulty falling asleep, light sleep, constipation, migraines, palpitations with no clear cause, poor stress tolerance, chronic fatigue, irritability. Magnesium is involved in more than 400 biochemical reactions. When it is insufficient, the body does not collapse immediately. It slowly loses efficiency. Energy production declines. Muscles remain contracted instead of relaxed. Blood vessels constrict instead of dilate. Insulin sensitivity worsens. Inflammation increases. Neurotransmitters like serotonin and GABA decrease. Sleep quality deteriorates. This is why many people notice real changes after correcting magnesium insufficiency for 30 days. Sleep becomes deeper. Anxiety decreases. Muscle tension fades. Bowel movements normalize. Migraines become less frequent. Mental clarity improves. This is not stimulation. It is restoration. Daily magnesium needs are well established. Women require approximately 320 to 350 milligrams per day. Men require around 420 milligrams per day. For simplicity, most adults function well around 400 milligrams. But here is the key point. If someone has been insufficient for years, meeting daily requirements is not enough at first. The body must also repay the deficit. Just like financial debt, deficiency must be corrected before balance is restored. Food should always come first. Magnesium-rich foods include leafy greens, seeds, nuts, legumes, whole grains, yogurt, fatty fish, and avocados. But reaching 400 milligrams daily through food alone requires consistency and volume that most people do not achieve. This is why supplementation becomes useful for many. Not all forms of magnesium are equal. Magnesium glycinate is well tolerated and supports relaxation and sleep. Magnesium threonate is known for its effects on cognitive function. Magnesium malate supports energy production. Magnesium citrate supports bowel function and overall absorption. Magnesium oxide and magnesium sulfate should generally be avoided. They are poorly absorbed and often cause diarrhea without delivering meaningful benefit. More is not better. Excess magnesium is excreted through the intestines. High doses do not accelerate recovery. They simply cause discomfort. Most people benefit from starting with 200 to 300 milligrams per day and adjusting gradually. Magnesium should not be taken simultaneously with certain medications such as antibiotics or thyroid medication. Spacing doses is important. People with kidney disease should always consult a healthcare professional before supplementing. Correcting magnesium insufficiency is not a miracle cure. It is restoring a missing foundation. When that foundation returns, the body remembers how to function properly. This is why magnesium does not feel like a drug. It feels like normal. And when normal returns, it shows.